Incidents of nursing home abuse have become more common in the United States and can be devastating. The statistics are quite concerning. In 2019, 64% of nursing home staff admitted to abusing elders. Victims of nursing home abuse experience a mortality rate 3 times higher than normal. For every reported case of elderly abuse, 24 go unreported. An estimated 5 million elderly people are abused each year. With the prevalence of nursing home abuse, it's vital to recognize the warning signs. Once you know what to look for, it's easier to determine whether an elderly nursing home resident suffers from abuse. Of the 7 types of recognized elder abuse, 5 are most common in nursing homes: physical abuse, psychological abuse, financial abuse, sexual abuse, and neglect. Physical abuse includes using violence or force against an elderly person in an effort to cause injury or harm. Common signs of physical abuse include bruises, black eyes, welts, lacerations, or rope marks, bone fractures, broken bones, or skull fractures, open wounds, cuts, or wounds that don't heal, broken eyeglasses or other signs of physical mistreatment, signs of bodily injury like burns and scalds, unexplained hair loss, clumsiness, and unexplained falls, insomnia, and difficulty sleeping. Just remember that physical abuse victims may change their story if asked about their symptoms. Evidence of emotional abuse isn't always easy to spot, although a sudden change in behavior is often a red flag. It can include verbal abuse like yelling or cursing, withholding critical support, isolating them from friends, or limiting choices so they're no longer independent. While psychological abuse won't leave physical marks, it can lead them to act in unusual ways. Warning signs to look for include emotional agitation, acting withdrawn, non-communicative, or non-responsive, losing interest in their favorite activities, odd behavior including sucking, biting, or rocking, changes in sleeping patterns or eating habits, changes in personality, depression or anxiety, extreme dislike of a particular caregiver, another older person's report of being mistreated, symptoms of PTSD. Although sexual abuse is the least common form of abuse experienced by people in nursing homes, it does occur. Examples include when someone close to an elderly person makes an unwanted advance or initiates an act of sexual assault. It can also occur between 2 elderly people who don't have the mental capacity to consent to sexual contact. Common red flags include bruises around the breast or groin, unexplained venereal disease or genital infections, difficulty sitting and walking, irregular vaginal or anal bleeding, showing fear or agitation around a particular person, pornographic material being shown to an older adult with intellectual impairments, blood found on sheets, linens, or clothing. Neglect is a very common occurrence, especially in nursing homes or assisted living facilities that are understaffed. Some warning signs of neglect can include poor personal hygiene and untreated bed sores, dehydration and malnutrition, unattended or untreated health problems, hazardous or unsafe living arrangements, unsanitary living conditions like soiled bedding, strong odors, or inadequate clothing, lack of available food in refrigerators or cupboards, reports of elders being neglected or abandoned. Many elderly persons fall prey to financial abuse, where abusers take a senior's money or property without their knowledge, understanding, or consent. Of all nursing home abuses, it may be the hardest to detect due to its complex nature. There are several indications of financial abuse to look for: changes in bank accounts or banking practices, unexplained credit card charges, higher than usual credit card balances, unexplained money withdrawal by someone accompanying the senior, additional names on senior's bank signature card, abrupt changes to an elder's will or power of attorney, the disappearance of funds or valuable possessions, unpaid bills despite the availability of funds, forged signatures on legal documents and checks, uninvolved relatives who want rights to the elderly person's property or possessions, sudden transfer of assets to a family member or other individual, and older adults' report of financial exploitation. Unless trusted family or friends check in on seniors regularly, there's a minimal pressure on nurses to ensure they receive adequate care. It's important to note that many risk factors increase the chance of an elderly person becoming a victim of abuse. Chronic medical conditions and poor physical health, functional disability and dependence, mental health problems, financial dependence, lower socioeconomic status, substance abuse, high levels of stress and poor coping mechanisms, prior exposure to trauma, limited social support. It's not only the victim's situation that contributes to nursing home abuse. There's also risk factors associated with caregivers. Many of the red flags that a caregiver might become an abuser are similar or identical. Chronic medical conditions and poor physical health, mental health problems, financial dependence, substance misuse, high levels of stress and poor coping mechanisms, negative attitudes toward the older adult, early childhood abuse. By knowing the warning signs of elder abuse, you can help keep vulnerable people safe. If you believe a family member was injured due to elder abuse, maltreatment, or neglect in a nursing home, reach out to us for a free case review. We listen to your concerns and help seniors receive the care they deserve. NursingHomeAbuse.org, exposing nursing home abuse and helping seniors get justice.